we first learned about Abby's diagnosis, she was about 1.5 years old. I think I was overwhelmed. I think there was some denial involved. It was very hard to admit that this perfect little baby maybe wasn't exactly what I thought it was going to be.
Abby, when she was little, I think she must have been 3 or 4 when we first saw her and I first had a chance to see her. She had a lot of spasticity. She, unfortunately, also had a lot of weakness.
Spasticity or tone in the context of cerebral palsy takes the form of tightness in the muscles.
Spasticity has a variety of different treatment options, and it depends on the age of the child, the level of spasticity, and the general diagnosis. But we have things that range from simple range of motion exercises, braces or splints, orthopedic surgery, to botulinum toxin injections, to phenol blocks, rhizotomies, intrathecal baclofen pumps. It runs a whole gamut of different types of treatments that we're able to provide here at Gillette.
The treatments that Abby has had done here have impacted every aspect of her life.
Gillette has just been a positive influence on her and us as well.
Mm-hmm.
You know.
We can't always get rid of spasticity completely, but we do have treatments that can improve spasticity or the tightness or abnormal tightness of those muscles. If we can help them do more for themselves and be easier to take care of and more comfortable, then those are the kinds of things we look at trying to provide for.
The goal of each of the 2 surgeries, the rhizotomy and baclofen pump placement, is to reduce tone to improve the patient's function, make them more comfortable, make them easier to care for, and prevent future orthopedic deformities. Selective dorsal rhizotomy surgery involves dissecting out sensory rootlets within the spinal canal, cutting the abnormal ones, and thereby decreasing abnormal signal to the motor system and decreasing tone. At each level, we dissect out anywhere from 5 to 20 rootlets. And typically here at Gillette, we end up cutting 20 to 40% of the rootlets.
They've done a few different things to improve my mobility, and so I won't be in a wheelchair when I'm 20, but there's still more to be done.
The physical therapist, making everything fun. I mean, physical therapy sometimes isn't fun. Especially when you're doing things like rhizotomies. That's a long process. There's some long, tough hauls there and some things that they have to go through to get better after that type of a surgery.
An intrathecal baclofen pump is an implanted device that delivers drug via a pump placed in the abdomen. The nice thing about a baclofen pump is that the results are all reversible. So if the amount of tone reduction is too much, the amount of drug delivered can be reduced, and if for whatever reason the pump doesn't work, it can be removed.
What we want for Abby is to continue functioning, improving, living life to the fullest, all things that Gillette has helped her achieve. Abby knows that she has cerebral palsy, but she lives her life with the motto that there's nothing she can't do.
The doctors at Gillette make me feel like I can do anything I want, and they'll help me do it.